Okay, good morning, everybody, and welcome back to Security Health Plan Academy, Security's monthly webinar series designed to provide you with information relevant to your health, wellness, and healthcare plan. Today, we are going to dive into alcohol and substance use with registered nurse slash clinical coordinator, Tammy Newman. Tammy has tallied over 32 years of experience in substance abuse treatment and prevention. Before we get started, I do want to remind guests that they are welcome to submit a question using the chat feature located toward the bottom of your screen. If we are unable to address your question during the live event, we will provide our response in the follow-up communication scheduled for later this month. All right, Tammy, I will hand the baton to you.
Well, thank you, Ashley, for the introduction. And I would like to thank Security Health Plan for the invitation to present this information to its members today. I know that my bio information was posted on the Security Health Plan website, but I would like to add an additional detail. I would like to share my age with folks, and is that I am 62 years old. And I feel that it is important when I talk about the risks of alcohol use, appropriate substance use with aging, because we are all aging together. And indeed, the goal is for good health and safety as we do. So the learning outcomes for today for review is that participants will be able to learn about the low risk limits of alcohol use and what can be too much, understand when prescription medication use may become a problem, and to identify how and where to seek help with alcohol and substance use concerns. For the presentation today, I will be specifically addressing prescription medication, not illegal or illicit street drug medication use. That could be a whole nother presentation for another time. And so I wanted to focus the information today on these particular substances. So today, the entire month, a piece of trivia to share with you all is that April is National Alcohol Awareness Month. And is that every April is designated by the National Council of Alcoholism and Drug Dependence, and they sponsor Alcohol Awareness Month. And the particular proclamation for the state of Wisconsin is from Governor Evers. And a paragraph from that proclamation I felt was very appropriate to set the background for what we'll be talking about today. And is that this is an opportunity for all Wisconsinites to examine their drinking habits, assess the effects on their overall health and well-being, utilize resources such as those available to the Wisconsin Department of Health Services website to learn more. And I will be providing a link to the DHS website at the end of the presentation. So alcohol use in moderation, so as a starting point. And so in moderation is considered to be by adults of legal drinking age. And adults of legal drinking age, they can choose to not drink any alcohol at all, or drink in moderation. And one of my roles as clinical coordinator with Family Health Center Alcohol and Drug Recovery Services is that I follow up with patients at Marshfield Medical Center who and all patients are asked questions about alcohol use and substance use when they're admitted to the hospital. And sometimes patients who may overuse alcohol, that their replies generate a score. And then I and my nurse colleague are asked to follow up with patients, and we have a conversation about alcohol use. And so I have these conversations with folks every day, and a very important piece of information. So in moderation, it is 2 drinks or less in a day for men. And that is on a day that people do drink alcohol. That does not mean that you need to drink 2 drinks a day. And then for women, it is 1 drink or less in a day. There are some resources that may indicate that there is a change for when men are age 65 and above. You may see it indicated that actually it is 1 drink or less in a day. I really need to adhere to the guidelines, which does not split it out for older men. And so this is the information that is offered, and the source of this information is from the Dietary Guidelines for Americans from 2020 to 2025. So this is the up-to-date information here. The other important piece here is what is a standard drink. And so it would be a can of beer, and that is at the standard 5% alcohol. A lesser amount, 8 ounces if it is malt liquor, 5 ounces of wine. That is very important there are many different sizes of wine glasses. So if a person enjoys a glass of wine, it would be really important to pre-measure where does 5 ounces look like? What does it look like in that wine glass? So it is easier to pour it at that accurate amount, at the serving amount, not fill it up to the top. Some glasses are such, the volume is such that it could hold up to 2-3 drinks at a time. If a person enjoys distilled spirits, it is 1.5 ounces of alcohol. 1 shot is 1.5 ounces. So the drink would be considered 1 shot per drink. Mixed drinks get kind of tricky because there are some mixed drinks, some cocktails that do include more than 1 type of alcohol. Or include more than 1 shot per drink. So a person would have the possibility of over drinking and not be very aware of it. There are some people who should not drink at all, and that it is safest. And so when we're talking about low risk limits, for some folks, it is not even drinking at the low risk limits would be too much. And so for the folks that it is safest to avoid alcohol, if a patient takes medications that interact with alcohol. And this is why it is so important that when you have your conversation with your medical provider, and that you share accurately what is how much alcohol that you use, or if you use, for example, a lot of people use cannabis, but again, we're not going to talk about that here. But again, it is important to be accurate with the amount of alcohol that a person drinks. For people who are managing a medical condition that could be made worse by drinking. For people under the age of 21, should not drink any alcohol for brain health and healthy development. If a person is recovering from an alcohol use disorder, or if they're unable to control the amount of alcohol that they drink. For people who are pregnant or who might be pregnant, or for individuals, particularly older adults, who are planning to drive or operate machinery. And machinery, I know that people are no longer perhaps, driving large machinery that maybe they did in their occupation, but this would include things such as lawnmowers. And so also for individuals who participate in activities that require skill, coordination, and alertness. One of the issues that I bring up when I talk with patients is that the increased risk for alcohol-related falls with aging, and that and I will have a lot of people who will tell me, lady, it was the rug, it was the dog, it was the cat. But again, if a person has some alcohol on board, maybe reaction time isn't quite as it could be if a person did not have alcohol on board, or decisions or coordination. And so again, any alcohol can be a risk. And so a person does need to be respectful of the alcohol that they use. Further evidence for further thought, some considerations for you. I know I don't like to read off a slide, but sometimes if there are words that I just can't leave out, and the information is so important, which is why I include it. And so bottom line is that, if a person, the more alcohol a person uses, that increases their risk of death from all causes compared to people who use alcohol at lower levels. And even people who drink within the recommended limits, those low risk limits that we talked about, it may increase the overall risk of death from several types of cancers and some forms of cardiovascular disease. And just, I guess, in a point that I think a lot of people acknowledge that people have and have carried for a long time. And that's why I wanted to include it here. The dietary guidelines does not recommend that any individuals who do not drink alcohol start drinking alcohol for any reason. And sometimes there's people will say, oh, I have a glass of wine for my heart health. Well, I wanted to share, there was a recent, very large study with over 300,000 adults about that very thing. And so that study did indeed find that the people with the lowest heart disease risk were those folks who are the light to moderate drinkers, even lower risk than those people who did not drink alcohol. However, the important piece that they found is that those people the light to moderate drinkers, were people who tended to have healthier lifestyles overall. Those are the folks who ate their veggies. Those are the folks who did not smoke. So it is that benefit that people were attributing to the moderate, light to moderate alcohol use, or maybe actually due to the healthy lifestyle habits that those folks practiced. So certainly alcohol should not be recommended to start to improve any cardiovascular health. And the message that I want to very much emphasize within the presentation is that any conversation about alcohol use, about how alcohol use pertains to your health, please follow up with your primary care provider and have those conversations. Is that, people's health is individualized, their medications are individualized, and so it is very important for you to have that personal one-on-one conversation as it pertains to you. We'll segue here to prescription medication. And I guess I just want to say to come away with alcohol. And when we're talking about prescription medication, I wanted to emphasize that alcohol is the substance that, when we're talking about substance use, is that alcohol is the substance that older adults use and misuse most frequently. And how does that pertain to prescription medication, perhaps? We'll talk about opioids, a lot of discussion about the risk of opioid use, and people who drink alcohol while using opioids, it certainly increases the risk of death for opioid overdose and death. Both opioids and alcohol are considered to be nervous system depressants. What is prescription medication misuse? It is very simple, taking a medication other than it is prescribed, whether by accident or perhaps on purpose. Examples of that would be taking more than needed, taking another person's medications. Psychoactive medications are of most concern with older adults, and is that those are medications that affect brain function. That includes opioids. Those are medications that are taken to relieve pain. And then also central nervous system depressants. And that would be sleep medication, perhaps certain types of anti-anxiety medication. What comes to mind is a group of medications called benzodiazepines, such as Valium, lorazepam, clonazepam, such things. And so those are, again, of the most concern. What are the risks for older adults? It is the physiological and mental changes with aging. Metabolism slows down. What our bodies perhaps tolerated back in the day, not so much. And that happens to us. And people kind of go along until things perhaps do not go so well. And again, to just be conscious of that aging factor. Older adults tend to have more complex medication regimens. They just take more medications. Older adults tend to have chronic pain issues, from aging over time, sleep problems, mental disorders, such as depression and anxiety. Just at that time in life is that people go through major life changes and transitions, including retirement, environment, perhaps a relocation or a move. Perhaps a traumatic event that had happened earlier in life, and a person could not need to think about it or have to think about it because they were busier in their younger lives, perhaps with work and families. And so now is the time when people have more time to reflect, that they could be have reflect on those things that happened in their past, or social changes and isolation, perhaps being away from family. And so that is how people may turn to prescription medications for relief, which is which was prescribed for them, which is not the original intent for prescription. So what are some signs and symptoms of misuse? And I'm going to approach this from a couple different roles here. And is that it is so. And what is the difference between a sign and a symptom? Well, and is that a symptom is what a person feels, or sensation that a person feels on the inside. It is subjective. An objective characteristic is something that people can see. For example, if somebody had chicken pox, you would say, I feel itchy. That would be a symptom, but all the spots on our face, that people could see that. And so the reason why I bring that up now at this time, and is that it'd be symptoms, is that what are we feeling on the inside? What is happening to us? Or a lot of older adults, perhaps not only are we aging, but perhaps we are in care of an older adult, a parent, a relative, a neighbor. And so what are some things that we may see in our loved ones? For alcohol, it may be the memory problems. People are just not remembering. And that's also that's kind of tricky, because sometimes the memory problems, the cognitive symptoms that we see may at times be easily attributed. Oh, that person, we call them after supper, and that is when they usually have their beer. And so maybe there may be some, cognitive symptoms that are caused by the alcohol, but also it may mask some underlying cognitive issues as well. Physical and mental symptoms such as falls, incontinence, and continuing to drink with certain medications, even though it may be unsafe, and with certain medical conditions where it may be unsafe. Others may be concerned about their alcohol use and with their behavior. Perhaps a person is not quite taking as good as care of themselves as we have known them in the past, or of their living environment. With prescription medications, maybe it's is seeking the same prescription from different providers, and just not following that medication label, not taking that medication as prescribed. Maybe we are taking not our own prescription. Maybe then instead of one pill, maybe people are taking two. Maybe they're taking them more frequently than was prescribed in that time interval, not waiting as long as they should. Different route. Sometimes people with pills, sometimes people may crush and snort them, or if they're taking them for another purpose. Or fear of being without that, and that goes for alcohol as well. Might find little stashes of pills or alcohol in a purse, in a pocket, in those areas that people are very fearful of cutting off that supply. And so with getting help, it is that when you see your provider, it is that when you're asked the questions during the clinic visit, those are considered to be screening questions. That's kind of as a starting point. And if you just, I guess, so overall, not again, when I was talking about all those people that I see in the hospital, not everybody that I see, just because I have a conversation with them, is considered to be alcohol dependent. That is a diagnosis of a person who, if they have an alcohol use disorder. Those initial questions are screening questions, and fewer adults who screen positive for substance misuse may actually need treatment. I think that some people are fearful that if they tell the truth, that they are going to be sent to treatment. And it's that, well, a person needs to voluntarily go, if that's what they need, that indeed is what they need. But again, sometimes it is a matter that, behaviors may be changed through, professional discussion, education, and further conversations, perhaps, oh, this is what I do at the bedside, when I see patients, or which actually is a brief structured intervention. Sometimes when I will ask patients some more additional questions about their alcohol use, and we'll read back what the results say, and they say, well, it requires a brief intervention. And I say, and people get real nervous about that intervention word. And I'll say, you know what this intervention is just this conversation that you and I are having as far as, this looks like your alcohol use is risky. And, this is my recommendation. What do you think about that? And so again, it's just very important for people to start the conversation. And just want to, as we're on the last few slides here, last couple slides, is that getting help. It indeed is okay to reach out and ask for it. Is that we are here to help each other, and it is okay, indeed, to start that conversation about your concerns. And I always like to include when I talk to groups of people, is that if we can do anything going forward to create a kinder world, reduce the stigma so that people can feel more at ease about asking for help, language matters. For example, when I talk about someone who has alcohol use issues, I will say a person with an alcohol use disorder. You may hear the term alcoholic. Again, that is not a language that's in the treatment world here that we use. It is person with an alcohol use disorder. I'm aware that people in the groups such as AA, they do use those terms, but that is their language for that group. Another word that you may use, that you may hear, is addict. And that is the appropriate term there is a person with a substance use disorder. And so again, label jar is not people. And again, it is not a label. It is a person with issues that need to be addressed, and because it is certainly a part of their recovery and health picture. So to end today, I certainly would like to once again thank Security Health Plan for the invitation for me to share information with you today on this important topic, and acknowledge April as Alcohol Awareness Month. And then also to thank everyone who's participating today in the webinar for your time to learn more about this topic. I included my contact information here if anybody would feel the need to contact me after the presentation today. And then also I would like to share some resources with you, and is that I spoke about the dietary guidelines for Americans, and certainly people are welcome to look at those guidelines themselves. It's a large document, but there's a dedicated section about alcohol use. I also included the toll-free number for all of our alcohol and drug recovery treatment centers here. We have a Family Health Center, has outpatient services in Ladysmith, Marshfield, and Minocqua. The resource Rethinking Drinking, and that is particular to people with concerns about alcohol use. And then to the last resource, the Wisconsin Department of Health Services, Alcohol Use in Wisconsin, that has some excellent data points about alcohol use in Wisconsin. And it does indeed say that in Wisconsin here that we drink above the national average. We drink more in Wisconsin, but also we perceive the risk less. And so, and that again, that tends to affect our health and well-being. So, and that ends my presentation for today. Thank you.
Thank you so much. I enjoyed it as much as I did earlier this week again. I have a few questions that if you have the time to ask, and I'm just going to go ahead and go, if that's okay.
Absolutely.
So the first question we have for you is someone asked, can I ask the pharmacist about meds and alcohol? How will they know?
They are the experts of medication. And so they are an excellent resource. So as to ask those questions, I think that they would be more than happy that a person was concerned about that.
Okay. The MD asks me every year about alcohol. Am I drinking and how much? I don't feel it's a problem. I don't say I drink. Why should I tell them? What are they going to do about it?
in the presentation, we did talk about, and but it certainly bears repeating, and is that it's very important to include that complete health information to your medical provider. When they ask those questions about alcohol and substance use, and I think, I can't guarantee that people are going to perhaps like, the answer or a recommendation. Certainly not everybody who I speaks with, if a recommendation is for no alcohol use. Some people say, I'll say, what do you think about that? Some people say, not much. And so again, it is decreasing that risk. But again, it gives that provider all of the information so that they can give their best recommendations and your best treatment plan.
Another question submitted from our audience is, I want to quit. Should I just go to the ER? Will they evaluate me? I know too many people around here. What if I want to go where no one knows me?
For the appropriate next steps, it would be really important for you to talk with your medical provider. And for especially if people who want to quit, is that where it gets to be, for example, we take these calls quite a bit in our services, is that for people who have used alcohol, particularly daily over a period of time, and people want to safely quit, it may be risky for them to just stop. People may be at risk of an alcohol withdrawal seizure. And so that is why, as the people just don't, quit all of a sudden. It would be really important, again, to have that conversation with their open, honest about the details of their use. There is information, I believe that the Security Health Plan staff will be posting it here as far as what other treatment facilities are available. And again, not everybody would need to go to, and we're talking about quitting, I guess. So, and again, if you would want, I guess, a question, about quitting, or I guess just what we've talked about now, you also may call Family Health Center Alcohol and Drug Recovery Services. We get these calls quite frequently.
Great. Go ahead.
And then, I was going to say, excuse me, but I was going to say it is that just, if someone, wants to quit, and if someone is detoxified, that's, and it's important that their withdrawal is medically managed, but detox is not treatment. So it'd be really important if they had certainly that medical piece, that medically medically managed for safe withdrawal. But it'd be very important if they had the additional treatment piece to go along with that, so that sobriety and recovery could be continued.
That's great advice. Thank you. Are there certain MDs at Marshfield Clinic Health System who work specifically with alcohol abuse?
Yes, through the Family Health Center Alcohol and Drug Recovery Services, is that we have providers who we have addiction medicine providers.
Okay. And what should I be looking for on the CDC website for resources?
I believe that, and the Security Health Plan staff will be posting a website as a great starting place. That is just loaded with information. And so, yeah, so that will be a good place to start.
Okay. Are there any support groups around to help? Any local groups that you could share?
Yes, there are. One of the groups is Alcoholics Anonymous, or AA, and that is a mutual help group for people with alcohol misuse. There are, I know, meetings here in Marshfield, and there are meetings in little towns across the United States, across the world every day. I always tell patients that is an excellent resource. The price is right. They are free. But there are people who have maintained sobriety over a long period of time through AA. There's a group called Al-Anon, and that is a mutual help group for people who are concerned about other people, loved ones, with alcohol misuse issues. There is Narcotics Anonymous, and those are for another mutual help group for people who have substance abuse issues. And then there's also another resource called Smart Recovery. Sometimes in the mutual help groups that they address a higher power, spirituality, as a part of those groups. Smart Recovery takes a bit different approach, but is also another valuable resource.
Okay. And how do I get help for a friend, spouse, or family member? They are, well, the question is, they are killing themselves with drinking.
You certainly may call Family Health Center Alcohol and Drug Recovery Services. And again, some of the, oh, I know that gets to be a tough thing, is that we just really wish that person would be as concerned, about their substance use as we are. And so it kind of all depends, it would depend on, what the situation is. And so again, we just invite people to call and ask, so as we can, the appropriate need could be addressed.
Okay. And the last question I have that was submitted are there any meds that I can take to help me stop? I'm guessing stop drinking or
Yeah, there are medications that can help with helping people remain abstinent. There's no magic pills. And is that what I can tell you in treatment services? It is not just the medication. For those people who do use medication, it is the medication and the counseling together. But yes, and again, information will be posted by Security Health Plan staff, as our people may familiarize themselves with. There's like 3 medications specific to alcohol use.
Mhm. Okay, well, that's all I have for questions today. Thank you so much, Tammy, for joining us. This has been really wonderful. I think with that, we can go ahead and close.
Very good. Well, thanks again.
Thank you.
Mhm.
Have a great day, everybody. Be well.